Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Mapleson circuit, and we are looking at its classification. So we'll be drawing the diagram, so it is very easy to understand. So the first one is the Mapleson A. So let's draw some easy diagram so that we can understand. So this will be the patient end and this is going to be the RB, that is a reservoir bag. So we have these two structures. These two structures are present in the Mapleson A. So in Mapleson A, there is also the presence of this is known as the corrugated tube. So when this is the tube, there is two components which we need to know. So there are two components which you need to know. First is where the flow happens. So this is going to be the fresh gas flow. So fresh gas flow is nothing but the FGF. So this is a fresh gas flow. Next is towards the patient side, there is going to be APL. So this is nothing but the APL. So what is APL? APL is the adjustable pressure relief valve. So it is the adjustable pressure relief valve. So this is about the Mapleson A. So when you remember the diagram, it is very easy to know where the component lies. So there's a FGF component which is right before the RB, that is a reservoir bag, and towards the patient side we have the APL. So this was the Mapleson A. Now we jump on to the Mapleson B. So here Mapleson B, we have a very similar diagram. So we have the reservoir bag which is present. Then we have the patient end here. So this is the patient end. So there is also a presence of the corrugated tube is present. So what we are seeing here is the APL was already here. So this was the APL, and right close to the corrugated tubes, right close to the corrugated tube, we have the presence of the FGF. FGF is present right next to the corrugated tube. This is the Mapleson B. This is the Mapleson B. Next, so we saw the Mapleson A, Mapleson B. Now let's move on to the Mapleson C. So Mapleson C, this is easy to remember. So C for the corrugated tube, right? So this will be the reservoir bag, and then towards the patient we have the mask, that this is towards the patient side. So here there is no corrugated tube. So C means there is no C. So that is there is no corrugated tube. So we have the FGF. So there is FGF. FGF stands for the fresh gas flow, FGF. And right next to the FGF there is APL. APL stands for the adjustable pressure relief valve. So this is C. C stands for the no corrugated tube. So we saw C. Now let's look at the Mapleson D. So Mapleson D. So Mapleson D, how is it present? So here similar structure. So we have the reservoir bag on one side and we have the patient on the other side. So what is seen here is that there is a reversal. So it is completely opposite to that of the A. So you have a tube connecting here. There is presence of corrugated tube is present. So in terms of the Mapleson A, the fresh gas flow was towards the reservoir bag. Whereas here the APL is going to be towards the reservoir bag. So this is nothing but the APL which is towards the reservoir bag. And then next to the corrugated tube towards the patients, we have the FGF. FGF is nothing but the FGF is the fresh gas flow which is towards the patient side. So there is complete reversal here compared to that of the A. Next we'll move on to the E, the circuit E. So how is the Mapleson circuit E? So in Mapleson circuit E, there is going to be the corrugated tube which is present, and then there is again going to be the patient's end. So this is going to be the patient's end, and right next to the coagulation tube towards the patient there is the FGF. This is nothing but the FGF. And in FGF, in the E Mapleson circuit, there is no reservoir bag. This is very important to note. So E means it is empty. E for empty. This is very easy to remember. E for empty. Empty means there is no reservoir bag. RB is absent. Now this was about the Mapleson E. Now we look at the Mapleson F. So what is the Mapleson F? Mapleson F is where there is presence of a reservoir bag, and then we have the patient's end. So how is it different? So we have the corrugated tubes which is present, and there is a FGF. FGF is nothing but the fresh gas flow. So this is very similar to that of E, where the FGF it comes towards the patient end. So what we are seeing is towards the patient end, the FGF appears from the D, E, F onwards. The FGF it appearing towards the patient. So in terms of F, there is again the FGF which is occurring towards that of the patient, and towards there is a corrugated tube, And here the important thing to notice, there is no APL valve. So APL valve was absent even in E, and in terms of F also there is no APL valve. So APL valve is totally absent in terms of the F. Now continuing with some examples of the Mapleson circuit. So circuit A, the examples are McGill circuit. So there is McGill circuit as well as the LAC circuit. Now we move on to the type B. So type B is where it is obsolete. Then looking at type C of the Mapleson circuit, it is obsolete. Still it is used in the emergency resuscitation, that is the AMBU bag. The AMBU bag, if you see, it is nothing but the type C, where there is no corrugated tube, there is just FGF and APL. FGF is present towards the reservoir bag and the APL being present towards the patient end. Next is, we saw the ABC, next we look at the D. So D means it stands for the Bain circuit. So the Bain is also present is an example of the D circuit. Next we move on to the E circuit. So what is present in terms of the E circuit? In the E circuit, there is nothing but the Aries T piece. The Aries T piece is present in the E circuit. Next we move on to the F circuit. F circuit stands for the Jackson or the Rees. So it is a Jackson and the Rees, and F is nothing but a modification for that of the pediatric patients. So F is a modification. This is for the pediatric patients. So in the F, what we saw is there is a corrugated tube, there is a patient, and towards the patient end and the corrugated tube, there is presence of the FGF. And here the APL is absent. There is no APL valve. To learn and grow daily like this, please do subscribe.